of 1 unit. Winged smile again. I'm going to take the edge of the edge of orbicularis oculi. 12, we need I don't want to go too heavily or because Layla's cheeks are not very large. If you reduce the strength of orbicularis oculi too much, it doesn't pull the cheek up in the normal way, and you can look a little bit sad. So a smile that doesn't reach your eyes is what we're avoiding by keeping this lower dose quite low. 4 units, 2 units, and then 1 unit underneath your eyebrow. So I'm looking for any sign that orbicularis oculi is able to pull the muscle down, the eyebrow down. It's good for us because that means I'm looking for any sign that I'm looking for any. So this is how to improve the jawline with toxin. So primary complaint was really about trying to lift this jowl. The key thing here is what can we do with muscles maybe pulling down on the jowl, even affecting the cheek according to some papers. We are going to look at the pattern of the patism muscle. If you contract for me, see how it runs straight into where that jowl is, which is a good thing for us because that means if we relax it, we're going to have some effect. And then I usually have I call it an upside down Eiffel Tower pattern. You contract again. I basically build this out, softening that line. We shouldn't really have patismal band lines. It's more of a resort. A few little doses here, which can also help to relax some of that muscle that's pulling on this area. So this is how to improve the jawline with toxin. So primary complaint was really about. I learned this when I went to Necker Island at Richard Branson. Most injectors focus on where to inject, but not how deep. In every area of the face, you will get subtly different results depending on the depth. If you inject intradermally into the forehead, what you'll notice is blanching when you inject. It's also very hard to actually compress the plunger because there's so much resistance due to the connective tissue. So intradermal injections are seldom used in medical aesthetic because they are more painful and they actually are less effective at relaxing the muscle. So we need to go deeper than this. This is the hypodermis. You'll feel resistance as you go through the dermis, and as you get to hypodermis, it gets much easier to inject. What I've tried to do is just estimate the distance by which I'm fully through the dermis, but not touching periosteum. Most injectors focus on where to inject. So I'm looking for any forehead's the trickiest. Let's put the safety margins on. If you raise your eyebrows up for me, I'm usually thinking about the lower third of the forehead being a protected zone as my first mark. So you can follow the shape of the
forehead pain. Mm-hmm.
of the muscle.
You teach all of.
Leaving about 2 centimeters, 1.5 centimeters in a small forehead. Muscle here that I definitely don't want to treat. Raise eyebrows up again. You can then mark on the aponeurosis where there is no muscle. It's not a safety zone, but it saves you wasting product. And then the rest of this can be relatively confidently treated. But I would prefer, given that I've got a day for a follow-up, to leave this dose slightly lower than I could do. So I can do 2 units. And then 1 unit here. Forehead's the trickiest. Let's put the safety margins on. If you raise your eyebrows up for me, I'm usually thinking about the lower third of the forehead being a protected zone as my first mark. So you can follow the shape of the muscle. So learn my Botox brow lift technique. This is one of the most effective ways to elevate the brow and open up the eyes. When injecting the forehead, our goal is precise targeting of the frontalis muscle. You want to go through the dermis until you feel that slight release. This indicates you've just passed the fascia and are in the muscle. Hold your needle at about a 45-degree angle, insert through the dermis, and stop just after passing the fascia. This is where the nerve endings are most concentrated. We're aiming for the muscle, not the bone. Precision is key. Remember, it's about accuracy and understanding the anatomy. Learn my Botox brow lift technique. This is one of the most effective ways to elevate the brow and open up the eyes. When injecting the forehead, our goal is just after passing the fascia. This is where the nerve endings are most concentrated. We're aiming for the muscle, not the bone. Precision is key. Remember, it's about accuracy and understanding the anatomy. Learn my Botox brow lift orbital rim pressure. This is the deepest part of the corrugator. These are relatively long needles, so I'm not going to go all the way in. I'm aiming for the middle of the muscle. 4 units. 3 units. 1 unit. 4 units. 4 units. 3 units. Orbital rim pressure. This is the deepest part of the corrugator. These are relatively long needles, so I'm not going to go all the way in. I'm aiming for the middle of the muscle. 4 units. 3 units. 1 unit. 4 units. 4 units. 3 units. Orbital rim pressure. This is the deepest part of the corrugator. These are relatively long needles, so I'm not going to go all the way in. I'm aiming for the middle of the muscle. 4 units. 3 units. 1 unit. 4 units. When you're treating lateral canthal lines, it's probably the biggest bang for your buck. I'm measuring the distance of 1.5 centimeters from the lateral orbital rim and creating a 30-degree angle medially. Following that, you inject 4 units 30 degrees more medial from that lateral injection point, positioning them above and below. If you're using botulinum toxin cosmetic, that is 3 injections of 4 units on each side, a total of 24 units. When you're treating lateral canthal lines, it's probably the biggest bang for your buck just to put 4 units right in this point. However, different methods exist for laying out these injections. For this patient, I'm measuring the distance of 1.5 centimeters from the lateral orbital rim and creating a 30-degree angle medially. Following that, you inject 4 units 30 degrees more medial from. We were super busy, but oh my God, the patient with a brow ptosis. Brows get heavier. So a clinician thought what I need to do is relax this muscle is pulling down. Good idea.
They have cow.
Right on
Nice.
that point there. And then what happened?
They have big
Eyelid
house.
ptosis. So now they have brow ptosis and an eyelid ptosis. How do we avoid this? Well, the first thing
Very
is when you
yeah.
have a brow
Good house.
ptosis, most of your eyebrow is held down by the lateral component. So I wouldn't inject centrally. I'd be injecting around here. So my injection points to lift an eyebrow start here. 1, 2, 3.
What house?
Lift. Don't inject right centrally. And of course, the other thing is make sure you're injecting really superficially because if you
It's
go too
not
deep, you go
the
underneath the
decade.
pars oculi, through the orbital membrane, into the orbit itself, and that's where you find the levator palpebral muscle that causes the actual eye drop. So there you can see the muscle in there. That's the muscle we can't hit. Somehow that got hit in a patient who already had a brow drop. A patient with a brow ptosis. Brows get heavier. So that's one email. It was a 5. Where would you inject for a Botox brow lift? There are actually a number of different ways to do this. Let me start with the simplest way, which is one injection, just one of 4 units at the tail of the eyebrow like this. That will get you a really small brow lift. The next stage up, also quite small, is you can just extend the effect on orbicularis oculi. Maybe one underneath the eyebrow. That's also a very light little lateral lift. It's not going to give you McDonald's eyebrows. If you want more of a lift and you do go down this route, then you start to relax the central part of the forehead. If you just relax the central part of the forehead, it leaves a lot of muscle here untreated. And this causes an imbalance. You have decrease of muscle activity centrally and it causes an increase in muscle activity laterally. And that's what causes a lateral brow lift by treating the forehead. You should also treat it with the glabella because otherwise a small proportion of people, their eyebrows are pulled down by the glabella complex. And then you can get that with a lateral lift, which is your Spock brow. So in terms of creating an eyebrow lift, start small with, it's been 7 days since we treated Layla, and look, she's got movement. Many of your patients will phone up and say, Dr. Tim, I look like I've had a stroke. Obviously, it just clicked, like I have to do this. Just imagine treating this patient with a little tweak in her cheek, just 0.5 mil on either side, and she wants the same feeling again in 6 months' time. So the injector repeats the same technique. Once again, the patient is happy, she looks a bit more edgy. The process then continues every 6 to 9 months with the same safe injection technique given to the patient who is so thrilled from her first result. Got a nice bit of dribble on your open mouth. Sorry, here's the most common way that young, pretty females get their faces ruined. It's in attempting to get the jawline straight. Wouldn't it be great if this was a perfectly straight line? I don't even necessarily think that's true. but it's common to aim for it. So injection points along here to attempt to do this seem to work, and often from the side, people will see this result. But as soon as they rotate their head forward, you end up with a laterally projected jaw, which makes them look masculine. Instead, we can enhance the chin and bring the chin slightly down, leaving this space more empty. Sometimes it helps to fill a little corner here, but in this point, right there where you're most at risk of masculinizing, keep the volumes really low or none at all. That way, you're enhancing this point, and if there's a good going angle, they should line up nicely. So bringing the chin forward makes the low point relative to the gonal angle stronger, which means a more heart-shaped face. And when the face is turned to look straight at you,